The next question is for Dr. Anand. Is there a summary of all the communities and their initiatives, particularly those doing things other than 5210?
That's a great question. Thank you. We have some information about each of the teams posted on our website at www.collaborateforhealthyweight.org. And we are in the process. We've just finished a final report and have created a team page for each of the teams that we've worked with and are in the process of uploading those to the website as well. And they do have some granular examples of things that the teams have engaged in. In addition to 5210, there are examples of healthy weight plans and other strategies that the teams have used, as well as links to some of the resources that Shayla mentioned earlier.
Wonderful. The next question is directed to Laura Kettle-Khan. Are there any common elements among the promising examples that you mentioned? For example, do they implement a certain strategy or multiple strategies?
Actually, yes. And as a matter of fact, one of the things I neglected to say when I was presenting is the one thing that we've noticed, and we have not documented this well yet, but as I said, that's part of the NCORE What's Working project is to document all this, is what we're realizing in our real, and this is very high level assessment of these locations where we're seeing BMI declines, is it truly is a multi-sectorial approach. It's policies from the perspective of urban planning and community managers relative to like complete streets and access to parks, and then it's also policies and regulations within school systems, like school districts, as well as individual schools, and it might even be what you would call individual schools that are almost champions of taking on these policies and really, I hate to say this, but there's in the school systems, there's the local wellness policies, which is a federally mandated policy that all schools are supposed to have, but there's no funding behind it, and et cetera. And so the level or the intensity of implementation varies widely. But if in some of the communities that are reporting successes, the schools are really taking those policies to heart and doing major overhauls of their food service practices and truly taking on the time allotments during the day and during the week for physical education to really get the kids to have an opportunity to be extremely physically active, at the moderate and vigorous level. And so when all those things, those multiple components come together, that's what that's when and where we're seeing success. And so as folks have mentioned on this call today, it's not one single driver. It's almost like it's got to be this mix of a whole bunch of different forces coming together that even, how do I say this, that it seems to be supporting and encouraging a social norm change. And when I say social norm, I mean social expectation of the health of their community. And that's when we're seeing the actual declines in BMI. Unfortunately, right now, today, we don't know what that magic mix is, and I'm almost suspicious that there's not going to be any particular magic formula, or like you have to do X, Y, and Z. It's going to be a cluster of different things that have to happen. But as I mentioned when I was talking earlier, that's what we're trying to tease out from a research evaluation perspective of getting some tools and protocols developed that we can share with communities to say, you've got to at least do a blend of, you know, X, Y, and Z, or it's not going to happen. Because just to work in one sector doesn't work, I mean, is not showing results. You can't just have a single champion. You can't just have lots of money. It's really got to be very dynamic, and so that's what we're. I don't have the data to show that, but that's where we're headed. I mean, I know a year from now that's what I'm going to say again.
Great. That's actually very helpful and very informative, Laura. Thank you for sharing that with us. Our next question is to Kari and Shayla. Many schools do not want to adopt or implement policies because they feel they will be sued if they do not follow them. They prefer guidelines instead. Do you find this to be the case in your schools?
This is Shayla. I'll go first because we've had a lot of engagement from our school district, and I think it was a process of initially reaching out to staff and parents and from within the school district. So first of all, having the leadership of a superintendent that really felt this wellness was important, and then a staff person in charge of wellness in the district. So I feel like those were two critical pieces because years before that was in place, as a parent in the district, without policies set in place, I really did have a hard time at the local level working to support improved wellness at a local level, at a school site. So coming from the top was really critical to that process, and I think that it was not overnight. It was really testing it at local sites was part of it, to engage parents and then have those parents be sort of like the positive deviants and be spokespeople for the community and go to board meetings. And what another critical thing the superintendent did was when the principals report to the board the status of their schools, which is a traditional event, and they put together a PowerPoint and they report on what's going on at their school site, what their testing is, and the wellness was a key component that was included in that. So then suddenly principals were showcasing and sharing and highlighting and didn't want to be left behind. So there was sort of like multiple levels of engagement from the top, from the bottom, from a grassroots level. And I think that really, over time, led to the very strong wording. And even removing chocolate milk had some pushback from, like, Dairy Council and, you know, some local, you know, even the food services people were concerned about dropping revenues and things. So, but once the kids were engaged and parents, and it was just, it made sense to remove that as part of the overall strategies that were going on.
And this is Kari. In our community, I can't say that we've really dealt with the issue or heard feedback about schools being afraid of being sued for implementing a policy. I guess one of the challenges, and this is different than Shayla has cited in San Diego, is that you know, we don't necessarily have our district leadership driving or commanding that we you know, take this on district-wide. Our schools here are really autonomous, and our principals have a lot of power and authority over their own schools. And so, you know, we're really leveraging those school nurses to have those conversations with the principals about the policy change opportunities and opportunities for practice changes at those schools, and working with the school health advisory committees at the schools to make those changes happen. So it's, for us, you know, it's a little bit school by school in terms of some of those policy changes. You know, we're hoping that that will change as we build this culture that is demanding healthier policies and practices.